Hello, my name is Ryan, and we are going to talk about the number 9 cots that Yukon EMS uses for in-territory medevacs. Starting with the basics, there are 5 parts to the setup: the number 9 itself, the thermarest, the life blanket sleeping bag, the liner, and the pillow. To set up, open the number 9 and pull out all of the parts. Place the number 9 on the cot. If the patient is not spinal motion restricted, lift the back support by squeezing the handle and lift up to the desired position. Release the handle and ensure that the locking pin has engaged in one of the holes along the shaft. The cot's chest belt then goes under the back support but over the frame. Next, unfold the thermarest and lay it on the number 9. Open the valve located in one of the corners to allow the thermarest to passively inflate. Once it has inflated, remember to close the valve again to keep the air from escaping when the patient is placed on the cot. Lay the life blanket on top of the thermarest. To differentiate the head and the foot, look for the square and round ends. The square end is the head. The life blanket is composed of 2 parts. These are attached together with snaps along the outside edge, an outer shell with handles, and an inner soft liner. Secure the life blanket with the litter clips. Attach one end to the upper handle of the life blanket. Slide the litter clip through the open section of the number 9 and clip to the opposite handle. Next, unfold the liner and place with the blue side down the life blanket. Undo the corner snaps on the life blanket and re-secure through the holes on the corner of the liner. This is what a completely set up number 9 should look like. Once the patient is on the number 9, bring the sides of the life blanket to the middle of the patient and snap together, being careful not to entangle any cords or lines attached to the patient. Attempt to completely wrap the feet of the patient and pull the drawstring tight. Once the patient is completely wrapped up, secure with belts. There should be a chest belt with shoulder straps and leg belts from the number 9 and a second set of leg belts from the cot. If the patient is in spinal motion restriction, then the chest belt from the cot would also go over the top of the patient. If the non-spinal motion restricted patient is on continuous cardiac monitoring, the monitor can be placed at the head end of the cot under the back support of the number 9. If there is an IV infusion running off pump, then it needs to be clamped off and placed inside the life blanket with the patient, especially if it is below 0 outside, to avoid freezing the IV fluid. If there is a pump attached to the infusion, the pump can be placed between the patient's legs near the feet, under the life blanket in the winter. Fully urine collection bags are also placed inside the life blanket at the patient's feet. The patient is now ready for transport. Cleaning up. After each use, the in-territory setup must be disinfected. The blue liner is thrown in the trash. If it is soaked in bodily fluids, it should be placed in the proper biohazard receptacle. The life blanket gets placed in a laundry hamper as a single unit, as well as the pillowcase. The pillow, thermarest, and number 9 each get wiped down with Virox wipes. To repackage the kit, lay the open number 9 upside down. A blue liner is placed under the zippered section near the feet. Take the thermarest, open the valve, fold it twice, and place your body weight on it to remove all the air. Close the valve prior to getting up. Place the folded and empty thermarest under the back support and close down the support. Place a clean folded life blanket near the folding point and a pillow with a pillowcase between the feet. Fold the number 9. Secure all belts on the same side of the number 9 as shown. We hope that you have been able to learn the basics of the in-territory number 9 setup. Thank you for your time.